starting Medicare can be daunting to say the least, but it doesn't have to be. So today, we're going to try to maybe possibly downgrade it to just complicated and confusing, because we're going to talk about the 5 most important things you need to know before you start your Medicare journey. This is Michael's Medicare, where we talk about all things Medicare. Everything from original Medicare, Medicare Part A, Medicare Part B, Medicare Advantage, Medicare supplements, and everything in between. And if you find this information helpful, please don't forget to like and subscribe and to follow, because of course it helps the channel to grow, but also because it means you'll get notified when our newest videos come out, so you can make more, better informed Medicare decisions moving forward. All right, here we go. So let's start this one off at the beginning, literally for Medicare, which is when you can start your Medicare coverage. For many people, it's pretty simple. On or around your 65th birthday, you'll get a red, white, blue card sent out to you from Social Security. But this is not always the case, and it's always not just as simple as turning 65, because there are actually many different entry points in the Medicare. First, and really the easiest, of course, is when you turn 65 years old. But it is actually earlier than that, because although your Medicare may start the month of your 65th birthday, if you're looking at the other accompanying Medicare accoutrement, things like Medicare Advantage or Medicare Part D plans, you can actually enroll in those 3 months before the month your Medicare start date. Now, the second entry point into Medicare is going to be for folks who are under 65 years old and are disabled. Now, this one is actually probably the second most utilized Medicare entry point that we have seen, because the folks who are disabled, usually on an additional program like a Social Security Disability, SSDI, for a minimum of 24 months or 2 years, and of course meet the other Medicare requirements, they can enroll into Medicare after those 24 months of disability at any age. And the last one that is important to know, and really the least used, luckily, entry point into Medicare is for those folks who have specific qualifying chronic conditions, primarily if somebody has end-stage renal disease, ESRD, or ALS, or Lou Gehrig's disease. Both of these illnesses specifically would be qualifying illnesses to enroll into Medicare if somebody is under the typical 65 years old and meet the other Medicare requirements. The number 2 thing that is important to know prior to starting your Medicare is to know the cost, because the cost can be a big surprise to folks who may have had different coverage through their work, or maybe through their health exchange, or even directly through a private health insurance plan. So let's talk about the Medicare cost. Now, fortunately, the cost for Medicare is relatively low in comparison to private plans or even work plans. One of the biggest reasons for this is because most Americans who are Medicare beneficiaries, or as we call them, Medicaricans, the Medicare Part A portion doesn't have a monthly cost. We all pay into Medicare while we are working through a Medicare payroll tax. And for those who have worked the minimum 10 years or 40 quarters and paid the Medicare payroll tax, there is no monthly cost for their Medicare Part A, which really helps to bring down the total cost. Medicare Part B, on the other hand, does have a monthly cost, regardless of how many and how much and how often you paid the payroll tax, which is in 2024 a cost of $174.70 a month, and that changes yearly, and by changes I mean it usually goes up. Another really important thing to understand about Medicare at the start is that when it was originally designed back in the day, it was made with a lot of holes in the coverage, partly by design, but partly because, they couldn't see into the future back then, which you can't really blame them for. But these holes are essentially the services and situations where a beneficiary is going to have to pay for their costs out of their own pocket. The first and the most glaring is the fact that original Medicare doesn't have coverage for prescription medications right from the start. That is, medications that get prescribed by the doctor and picked up at the pharmacy. Now, this is going to be covered under something like a Medicare Part D plan, not under original Medicare. Next, for stays in the hospitals under Medicare Part A, there is a $1,632 deductible for the first 60 days that someone spends in the hospital, plus daily costs for any days after those first 60 days. And lastly, and to a lesser degree, as far as holes as Medicare go, is for Medicare Part B, which is what helps pay for the daily healthcare costs, things like doctor's visits, specialist visits, x-rays, lab work, and the like. For Medicare Part B, it has a much smaller deductible, that is a yearly deductible of $240 plus a 20% share of costs that is paid by the beneficiary for all the remaining costs covered under Medicare Part B. Also, there is no limit to that 20% cost. Next, and equally important to know about Medicare, that goes hand in hand with the holes in Medicare, is how to get those holes closed up. And that is most often done with either a Medicare supplement plan or a Medicare Advantage plan. Both are good ways to get some of those costs not covered by Medicare covered, but which one would serve a person's best interest, of course, is going to depend on that particular person, their health goals, their budget, and their health care need. We have a whole video on each of these of which one works best for which situation, but in short, for a Medicare supplement plan, it will serve to just fill the holes that original Medicare, that's Part A and Part B, don't cover, at least to varying degrees. Meaning that for an additional premium monthly, the Medicare supplement will help cover some or almost all of those costs not covered by original Medicare, but it doesn't help with any of the drug costs. On the other hand, there are Medicare Advantage plans that really are a balancing act of healthcare options as far as doctors, RX, and networks in exchange for additional Medicare benefits and lower monthly costs, and assistance paying for those costs that are not covered by original Medicare, including prescription drugs in the case of MAPDs. Of course, it is a bit more complicated like everything in Medicare, but check out our Medicare Advantage videos and that'll give you a lot more insight and nitty-gritty about the different Medicare Advantage plans and how they work and who they might be appropriate for. The main point is that there are additional plans, Medicare Supplement or Medicare Advantages, that help pay for those holes that Medicare leaves. Lastly, and definitely not leastly, an important thing to know about Medicare is the fact that drug coverage is not covered under original Medicare. I think we've mentioned that a couple of times as we talked about before, but also the fact that there is coverage for drugs while on Medicare, which can be done through a Medicare Part D plan. Medicare prescription drug plans, or PDPs as they are known, are plans that are specifically good options for folks who want to keep original Medicare but also get coverage for their prescriptions as well and not be tied down to an MAPD. Again, we did another full video on PDPs, getting into the very minutia of them, the nitty-gritty, if you will, for the Medicare Part D plans. I would say go check those out so you can get a fuller explanation of how those work. And of course, we'll be doing updates as things move forward. But the Cliff Notes version is that Medicare Part D plans are offered by a large variety of Medicare health plans. They cover just the prescription drug portion of a person's yearly health care costs, and they range pretty wildly in cost monthly. In general, the Part D plans will have a list of drugs or a formulary that are covered under those plans. And even though the list will cover at least 2 drugs for every covered Medicare illness, they don't have to cover all the drugs that are available for that particular illness. Furthermore, each drug price is negotiated by each drug plan, which can mean that the same medication on one plan can be more or less expensive on another. All right, so that about covers at least 5 things that are important to know before you start your Medicare. And as you can see, this stuff can be complicated and it can be convoluted and it can be messy. So if you are looking at this, it all seems a bit overwhelming, but if you want some help with it, trying to figure out which plan may fit your needs, feel free to reach out to us at the information down below, or you can leave a comment, or maybe even just check out our other great Medicare content on the socials, on YouTube, on Instagram. Don't forget to like, subscribe, and follow. So for Michael's Medicare, I'm Michael, hoping that you have a great rest of your day, and goodbye.